Donald Trump is back in the White House, marking a significant moment in American political history. His victory in the 2024 election has sent shockwaves across the nation and beyond, with reactions ranging from jubilation to deep concern. Many are left wondering about the implications of his return, particularly regarding his campaign promises and how they will shape the future of the country. Some of these promises, especially those related to public health, have sparked serious concern and debate among citizens and experts alike. Trump's approach to public health during his previous term was often characterized by controversy and a disregard for scientific consensus, leading to widespread criticism. Now, with his return to power, there are fears that these tendencies could resurface, potentially putting the health of millions at risk and undermining public trust in health institutions. Trump's campaign promises touched upon a wide range of issues, from the economy to immigration, each with its own set of supporters and detractors. However, it was his statements on healthcare and his proposed appointments that truly raised eyebrows and sparked intense debate. One particular promise stood out: the appointment of Robert F. Kennedy Jr., a known vaccine skeptic, to a prominent public health position, which has been met with widespread criticism. This decision alone has sent ripples of anxiety through the medical community and beyond, raising questions about the direction Trump intends to take on matters of public health and safety. The potential consequences of Trump's approach to public health are far-reaching, affecting not just policy but the everyday lives of Americans. His policies could impact access to health care, the spread of infectious diseases, and the overall well-being of the nation, making it a critical issue for all citizens. The decisions made during his presidency will have a lasting impact on the health and safety of all Americans, influencing generations to come. It is crucial to examine his promises closely and understand the potential ramifications for the health of our nation, as the stakes have never been higher. As the nation moves forward, it is essential for the public to stay informed and engaged, ensuring that their voices are heard in the ongoing dialogue about the future of healthcare. The collective effort of the American people will be vital in navigating the challenges ahead as they work together to safeguard the health and well-being of the nation. In these uncertain times, the resilience and strength of the American spirit will be tested, but with unity and determination, the nation can overcome any obstacle. Few decisions made by Donald Trump during his campaign generated as much controversy as his promise to appoint Robert F. Kennedy Jr. to a significant role in public health. This decision sparked intense debate across the political and scientific spectrum, with many questioning the implications of such an appointment. Kennedy, a lawyer and environmental activist, has become a prominent figure in the anti-vaccine movement. His outspoken views have made him a polarizing figure, admired by some for his advocacy and criticized by others for his stance on vaccines. His views, often based on discredited studies and conspiracy theories, have been widely criticized by scientists and medical professionals. The scientific community has repeatedly debunked many of his claims, emphasizing the safety and efficacy of vaccines. Despite this, Kennedy has cultivated a loyal following, tapping into a vein of distrust towards vaccines and government institutions. His ability to resonate with a segment of the population that feels marginalized or skeptical of mainstream science has only grown over the years. Kennedy's appointment, if it comes to pass, would be a clear signal of Trump's willingness to prioritize ideology over scientific evidence when it comes to public health. This move could be seen as aligning with Trump's broader approach to governance, which often challenges established norms and expert opinions. It would also be a major victory for the anti-vaccine movement, lending legitimacy to their claims and potentially emboldening them to push for policies that could endanger public health. The ripple effects of such an endorsement could be far-reaching, influencing public opinion and policy decisions at multiple levels of government. The potential consequences of such a move are significant. Public health experts warn that undermining trust in vaccines could have dire consequences for community health. Kennedy's appointment could erode public trust in vaccines, leading to a decline in vaccination rates. This erosion of trust could be particularly harmful in communities already vulnerable to vaccine-preventable diseases. This, in turn, could lead to outbreaks of preventable diseases like measles, mumps, and rubella, which have been largely eradicated in the United States thanks to widespread vaccination. The resurgence of these diseases could strain healthcare systems and lead to preventable suffering and death. The decision to appoint Kennedy to a public health role is not just about one man's views on vaccines. It is about the potential real-world consequences for the health and well-being of millions of Americans. The broader implications of this appointment could shape public health policy and the nation's approach to science and evidence-based decision-making for years to come. The appointment of Robert F. Kennedy Jr. is just one piece of the puzzle when it comes to concerns about potential anti-vaccine policies under a Trump administration. Kennedy, a well-known anti-vaccine advocate, has long been a controversial figure in public health circles. His appointment raised alarms among scientists and healthcare professionals who fear that his influence could lead to policies that undermine decades of progress in disease prevention. The Trump administration's stance on vaccines has been a topic of intense debate and scrutiny. Throughout his campaign, Trump himself made statements that cast doubt on the safety and efficacy of vaccines. These statements were not isolated incidents, but part of a broader pattern of rhetoric that has emboldened the anti-vaccine movement. Trump has repeatedly linked vaccines to autism, a claim that has been thoroughly debunked by numerous scientific studies. Despite the overwhelming scientific consensus that vaccines are safe and effective, Trump's comments have sown doubt and confusion among the public. The claim that vaccines cause autism has been one of the most persistent and damaging myths in public health. It has been refuted by extensive research, including large-scale studies involving hundreds of thousands of children. Yet the persistence of this myth has led to a decline in vaccination rates in some communities. While Trump has never explicitly called for the elimination of vaccine mandates, his rhetoric has fueled the anti-vaccine movement and created an environment where such policies could gain traction. This movement, which was once on the fringes, has gained a foothold in mainstream discourse, leading to increased resistance to vaccination. The consequences of a decline in vaccination rates could be devastating. Vaccines have been one of the most successful public health interventions in history, preventing millions of cases of disease and saving countless lives. A drop in vaccination rates could reverse this progress. Measles, mumps, rubella, and other preventable diseases could make a resurgence, leading to widespread illness, hospitalizations, and even death. These diseases, once nearly eradicated in many parts of the world, could return with a vengeance if vaccination rates continue to fall. This is not a hypothetical scenario. We have seen outbreaks of these diseases in recent years in communities with low vaccination rates. These outbreaks serve as a stark reminder of the importance of maintaining high vaccination coverage to protect public health. The spread of these diseases would not only impact those who are unvaccinated, it would also put vulnerable populations at risk, such as infants too young to be vaccinated and individuals with compromised immune systems. These groups rely on herd immunity to protect them from diseases that could be life-threatening. The potential for anti-vaccine policies to undermine public health is very real. Public health officials and medical professionals are deeply concerned about the long-term implications of such policies. They warn that the erosion of trust in vaccines could lead to a public health crisis. Trump's embrace of figures like Robert F. Kennedy Jr., coupled with his own questionable statements on vaccines, suggests that this is an issue he is unlikely to approach with the seriousness it deserves. The stakes are high, and the potential consequences of misguided vaccine policies could be dire for public health. Donald Trump's approach to public health extends beyond vaccines. Another area of concern is his stance on fluoride in public water systems. Fluoridation, the practice of adding fluoride to public water supplies, has been hailed as one of the most successful public health interventions in history. It has been credited with dramatically reducing tooth decay and improving oral health, particularly among children. Despite the overwhelming scientific evidence supporting the benefits of fluoridation, it has become a target of conspiracy theorists and those who distrust government intervention in healthcare. Trump himself has expressed skepticism about fluoride, calling it very dangerous in a 2015 tweet. While he has not explicitly called for an end to fluoridation, his comments have given credence to those who oppose it. The potential consequences of removing fluoride from public water systems are significant. Studies have shown that communities that have stopped fluoridating their water experience an increase in tooth decay, particularly among children from low-income families who may not have access to regular dental care. Fluoridation is a safe, effective, and cost-effective way to improve oral health. Removing it from public water systems would be a step backward for public health, disproportionately impacting the most vulnerable members of our society. Don't forget to like and subscribe for more trending news.